The median white New York household is over 29 times the wealth of the median Hispanic household, 16 times the median African American household, and 5 times the median Asian American household. AARP New York is focused on addressing these historical imbalances that affect 50-plus New Yorkers from communities of color in 3 interconnected areas: health, economic security, and livable communities, with the Disrupting Racial and Ethnic Disparities study. AARP, in partnership with the Hispanic Federation, the New York NAACP, the New York Urban League, and the Asian American Federation, created a platform to address these disparities and hosted a forum at the Hostos Community College in the Bronx, convening Latino thought leaders, elected officials, and local community leaders from across New York City to address the serious gaps that exist among older adults 50+.
Disrupting Disparities became a clarion call from the New York office with their partners to become an action agenda that addresses the barriers that limit people, not only again because of ageism, but because of all the other compounding impacts of racism that affect 50 and older communities of color.
We know disparities exist, but we don't know at what level. And this report really highlights that. So among city residents 50 and over, Hispanics' incomes are barely half of that of non-Hispanic whites on average, resulting in Hispanics receiving barely 60 cents to every dollar for whites in Social Security statewide.
If you're 50-plus Hispanic and you live in New York and a homeowner, chances are 30% of your income is going towards housing. 46% of Hispanics are what are called cost burden, compared to 34% of white Americans.
We're going to break into smaller groups and we're going to drill down on the 3 areas of focus: health, economic security, and livable communities.
The top 3 things that I heard was the issue of Alzheimer's, coverage around that, the issue of mental health, identifying that, and normalizing a subject that traditionally is taboo, the availability of housing, affordable housing, and then how elected officials can play a role to advocate and make changes in policy so that there's equity across the board.
We heard the most were that there is a lack of education about what resources are available, and that there are misconceptions about what it takes to participate in the economic mainstream.
The 3 topics that we heard the most were affordable housing, access to healthcare in the communities, and transportation accessibility.
In the areas of health, economic security, and livable communities, now is the time to ensure a more equitable life for everyone 50 and older. Join us in our efforts to craft an action plan that will create a more just life for 50-plus New Yorkers and their families.